Hello, I'm Richard Bowes. On October the 9th, I had three leaking heart valves operated on. I had a mitral valve repair, I had a tricuspid valve repair, and I had a new aortic valve. I was first contacted by the Brompton in early March, and they were keen to establish that my renal function, my diabetes status, I'm not diabetic, and my lung function were good, because they said this would be important as far as recuperation and recovery. In July, I had another consultation, video call, and from there on in, I had a weekly questionnaire, which was handled by Dr. Yadav's nurses, to monitor any signs, symptoms of deterioration. I then had a pre-op assessment letter arrive in early September, asking me to come to the Brompton on October the 4th. And I had 7 investigations, I believe, during the course of the day. And as we were about to conclude, and I had actually signed consent forms at that stage, I was asked to make contact, and I rang a specific number, and I was invited to return on the Tuesday, on October the 8th, for blood tests to match my blood, and that the surgery would take place on Wednesday, October the 9th. I spoke with Dr. Yadav on arrival, and then again prior to surgery. One of her colleagues, a fellow consultant from the Brompton, who we know, which was coincidental, came and spent time with both my wife and I prior to the surgery before Dr. Yadav arrived. And the whole combination of that, I think, was extremely reassuring. It was in the end very straightforward, and despite it being a major procedure, I wasn't at any time too overawed by it. Clearly, I was nervous on the day, because everyone fears the unknown, but I was put at ease by the whole team, and Dr. Yadav, in follow-up, she saw me in ITU and in high dependency. She then came in on the Sunday on the general ward, and was very pleased the way things were going. She then contacted me on the Monday evening following my CT scan to confirm that I'd be able to leave on the Tuesday, on October the 15th. And one of her support colleagues, Katerina Lopez, the advanced nurse practitioner, was a critical link in all of this, because I saw her each day and she was able to update me. But I would say the other thing that was rather good was Dr. Yadav texted me 10 days after I'd come home to just check on how I was. And then at week 20, I texted her to give her a progress report, and that's led to our consultation today.